Hello viewers and learners of the Postgraduate Diploma in Environmental and Occupational Health. Welcome to this session on Communication, Health Education and Counseling. This forms a part of the course MEVE 002, that is Health Care. So many of us have seen that we are facing some kind of problems related to our lifestyle and the disorders. This may be due to the urbanization, due to environmental pollution and several other factors. Genetic predisposition, that can also play a very important role. And some of us are so busy in our offices or in our working places that we do not have time to even concentrate on the proper diet that we consume. So therefore counseling, health education and the communication for kind of health awareness, this is very important, especially among the healthcare workers. Let us learn more about this in detail in this session. So from the preceding lectures, you would have understood the determinants for illnesses and the infections that are very common among the healthcare workers. For example, we understood about the sharp injuries, the needle stick injuries, and even when the healthcare workers are attending to the patients, they themselves can get affected by several infections, like for example the blood-borne infections or even the nosocomial infections which are acquired in the hospital. So that is why the healthcare workers especially, they are the first people they are the first people who have to be vaccinated or have to be immunized so that their health is not compromised, because they are the first line of defense, or the people who are actually giving the society the protection against any problem and any outbreak of the diseases. For example, in the COVID-19, this we have seen that the healthcare workers were the frontline workers, and if they were not there, majority of the people would have suffered like anything. So, but the absence of any illness or disease, that does not alone constitute good health. So, for having good health, for maintaining good health, several factors are responsible. As I told you, physical activity, yoga, mental health, then your diet, all this plays a very important role. So, just like we are environmentally aware and conscious, in the same way we also have to be aware of our health, aware of any slight problem that you face. You should immediately see that okay, there is something wrong with my system today and I need to take steps. Or for example, if you have put on weight, or if you find that there is some problem with your health, then immediately there are certain modifications which you yourself can do at home, and which you yourself can do with the help of certain simple activities or exercises which will not aggravate the situation, and you can keep these problems under control, of course always under the consultation of the doctor or the medical specialist under concern. So therefore mental health and well-being, this also plays a very important role and in the overall health of the population and also in the entire community. Urbanization and industrialization, also environmental pollution, all these have resulted in increase of diseases. For example, air pollution. So you have seen that in previous years or in the previous times, in ancient times, people did not have so much of the asthma problem and asthmatic syndrome. But now we are seeing that more and more people are getting the chest congestion, then the pulmonary related or respiratory distress, and the asthma and other conditions. So all this is related to the way people are living. It is the way we are responding to the environment. So it is related to our lives, be it at home or at work. Therefore, the diseases are connected to the way the people live their lives, and these are also termed as the lifestyle diseases. So that is why we are calling as lifestyle disorders and diseases. So when we are able to make some kind of lifestyle modifications to these disease, then that way we are able to control such kind of problems. Now the genetic predisposition, for example in a family, if the mother or the father or even the grandparents, they are diabetic, then in that case there is a possibility that the children or the grandchildren have this predisposition to get the high blood sugar levels or the diabetes. In the same way, they also say that carcinogenesis and cancer, this is also linked to the familial and due to the genetic reasons. So there are certain diseases which are connected to the family history. Even for example, they say that schizophrenia runs in families. So there are certain diseases which can be connected to the genetic factors, but then the lifestyle diseases, like for example, it is not necessary that a person, family member does not have diabetes, even he can also get the diabetes. That is because of the environmental factors. It is also because of the type of food that they are consuming. For example, if you are consuming a lot of the fast foods every day and you are not taking care of proper diet, so normally the nutrition or the healthcare workers, they tend to neglect their health. So they have to have a proper diet chart where there is an equal distribution of the protein, the fat, the carbohydrate, the vitamins, the minerals that they are all consuming. So all this has to be properly balanced. Only then the body will get the correct kind of the nutrition, and then they can tend to the patients and the people that they are working with. So the lifestyle diseases, the onset of these lifestyle diseases, their duration and also their resultant complications, all this are related in a large part to the lifestyle choices such as the tobacco smoking, alcohol consumption and also diet. So I gave you an example of diet, for example fast food. So this can trigger many kind of the diseases. Maybe one time or twice, anytime like if you are having it or consuming it rarely, that may not have a significant effect on your health. But if you make this as a regular habit of every day, then that can cause certain problems with your health. In the same way, if a person is a continuous or a chain smoker, then that again, that can actually char the lungs. That can bring about a lot of the scarring of the lungs, pulmonary problems, and that is why even on the packet of the cigarette, it is always written that this is injurious to health. There are so many advertisements and media and campaigns which are all a part of the education programs, health education programs, which are actually telling the person that this is injurious to your health and you need to wane this habit. In the same way, alcohol consumption. So too much, a person who is totally dependent on alcohol, he is not able to function well in his work, and there again the liver can get affected. So these are all the lifestyle diseases, because a person himself is addicting or getting addicted to such kind of habits, and then his health is getting affected in the process. Now the objectives of this module. So after listening to this module, you should be able to describe the lifestyle disorder and the disease, and also explain the kind of lifestyle modifications that can be done, certain prevention strategies which can be employed. Here again we have also given you the how a person, like even if he is having a lot of stress, even stress also how he can de-stress, and the company or the industry themselves can also make different kind of strategies in order to tackle the employees problems and promote their health and well-being in the society. Now first let us talk about the lifestyle disorders and the diseases. So lifestyle disorders or diseases, as I said before, these arise from the way the people live their lives. They are influenced by the lifestyle habits. Unhealthy habits and disorders, these will result in the clinical manifestations arising due to the disorders, and they are termed as the disorders and diseases. Now we can also call the lifestyle disorders and diseases as the diseases of civilization. High rates of economic development, urbanization, industrialization, these have all had a change in the lifestyle. For example, nowadays if you see, people are boarding the metros, they are taking the transport systems early in the morning, as early as even 5 AM. Because the place of their stay and the place that they work, that may even be 3 hours even distance. So they take long hours of travel. In the same way, in the evenings also they spend a considerable time in their travel. So in that case, they they are compromising on their healthy eating habits, and then they tend to consume something or the other. So these changes in their lifestyle, that has been identified as a major contributor for these kind of diseases. So these diseases are then also referred to as the diseases of civilization. Now let us understand some causes of the lifestyle diseases. So inconsistent diet, the undisciplined lifestyle, these are the most common causes of the lifestyle diseases. Although the healthcare workers are responsible for the health and the welfare of the others, they tend to neglect their own health. So that is, they are compromising their own health, and that is why they are facing so many of the health issues. And let me tell you, even their working shift times, this can also be quite strenuous on their health. Like they may be working, from the morning to the night time. Sometimes they may be even working for 24 hours at a stretch when they are assisting doctors in the surgery, the medical surgery and so on. In the same way, they may be also in the ward, they may be having certain shift, 12 hour or 15 hours shift. In that case, again, they may not be taking rest, and their day and night, the sleep patterns are also quite disturbed, and this can also give rise to tremendous pressure and stress on their health. Now the main causes of the lifestyle disease, this is due to the irregular and the junk food habits, then the tobacco and the alcohol intake, drug abuse also occurs among such workers, the smoking, then there is lack of sunlight exposure, because mostly they are in the inbuilt or in the indoor environments, and they are less exposed to the sunlight. So when you are exposed to good amounts of the sunlight, you get vitamin D in your body at specific time in the day, and most of them also have a sedentary lifestyle. Either they are working in the technical professions, for example in the X-ray department, in the radiology department, where they tend to sit on the computer, and or in other departments also, even when they are tending to the patients in their rooms. So they may be having certain sedentary lifestyle, which can again make them obese in the process. Then they may be taking up the occupational hazards. For example, they may be having some ergonomically unaccepted postures while lifting certain heavy objects or while doing their day-to-day activities. Then again, they may be facing insufficient sleep. As I told you, due to their schedule, they may be working late in the night, or they may be have to coming very early in the morning, and so on. So their sleep patterns are also disturbed. Then there are several other occupational factors and occupational hazards which are also influencing their health. So though some of the lifestyle diseases are genetic and familial, some examples I had given you in the previous slides, but the onset and severity of these diseases can be modified by the lifestyle choices. The most common lifestyle diseases which are affecting the Indian population. So now earlier in the ancient times in India, if you had seen, few people were having the cars at home, and they were totally relying on the public transport, and they had eco-friendly lifestyles. That is, even from their village to the school, which may be located somewhere far away from their villages, these students or the children and also the teachers, they all used to walk, they also used to bicycle. So these are all very eco-friendly choices that we make in our daily life. But now if you see, they are not making an attempt to walk. Maybe in the morning they are taking 1 or 2 rounds as physical activity, walking around their campus. That is still a good effort that can be done. Or even using the gymnasiums, going to the gym and doing small workouts, maybe on the treadmill or bicycling in the gym. That can also give you a good amount of the physical activity. But right now, if you see, the increasing urbanization is forcing many of the people and also the school children and even the college students, that they also are forcing themselves to these lifestyle where they require an independent vehicle, and they refuse to walk even for the small distances. So this can give rise to a number of the lifestyle diseases, like putting on weight. Obesity is one problem. And most of the common lifestyles which are affecting the Indians, they include obesity, and because of that they may be getting the type 2 diabetes, then arteriosclerosis, which is affecting the walls, thickening of the walls of the heart arteries. Then you get hypertension, that is high blood pressure. Heart diseases of various kinds are now being noted. Then the cancer, various kinds of cancer. So we need to ponder about, we need to think about why are more and more people getting cancers. So even the application of more and more hair dyes to make a person look younger, that is also creating a lot of problems. So you need to make friendly choices in life, the eco-friendly choices, and those choices which are acceptable to your health. Even a small irritation by using a cream or by using or by ingesting any kind of food product because sometimes even some grains can be allergic to others. Millets, some type of millets may be allergic to some people, but for others it may be alright. So we need to find out the problem which is creating such kind of incidences in our life, health threats, and work upon these issues. In the same way, stroke, due to heat stroke and due to even the cardiac and the heart attacks, the chronic obstructive pulmonary diseases, cirrhosis of the liver, and nephritis, that is the kidney failures, and so on. So there are so many diseases which are now affecting the Indian population. So the burden on the occupational health by the lifestyle diseases. So let me tell you, lifestyle diseases determine the pre-existing health condition of an individual, and they are further impacted by the occupational hazards. At the workplace, the human being or the human body, it is subjected to occupational hazards. Like for example, any person working in an industry, he would be subjected to the physical hazard. Physical means there may be a lot of noise. So due to that noise, they may be getting temporary or permanent deafness if they are going to work in such high levels of noise for a longer period of time. In the same way, they may be exposed to a high amount of heat. So again, heat can also cause a lot of problems. And even in the iron and steel industry, those factory workers who are working in the places where the smelting and high heat was going on, it is reported that they developed a lot of the kidney problems. Then there are chemical factors where a large amount of the chemicals are used in the chemical industries, for example in the textile industries, that can also cause a lot of occupational health hazards to the workers. Then there are biological factors. Now when talking about the healthcare workers alone, when we talk about the noise or in the radiology section, and also the waste management, and also chemicals and biological factors, they are a lot in the hospital and the healthcare sectors. So chemicals are used for the disinfecting the surfaces, disinfecting the wards and the clinics. Then in the same way, the biological factors, there may be so many of the nosocomial infections that they can get. For example, it could be due to the bacterial, the viruses, the fungi pathogens, and also certain other kinds of the parasites which are present in the hospital sectors. Then there are also psycho-socio-economic factors, psychological reasons, and also stress due to several personal and the problems which are related to maybe the salary, maybe related to their work, peer pressures, and so on. And also the ergonomic factors, as I told you, the posture also affects a lot. So all these are burden on the occupational health by the lifestyle diseases. So since the pre-existing health condition gets aggravated by these occupational hazards, it is important to first understand what are these lifestyle diseases. So the health status of an individual, that also should be determined first, so that you can minimize the exposure. So the lifestyle diseases are not necessary, it does not deem a person unfit to work. So he just needs to make some careful choices in life. So but it is important to mitigate the contributors to the disease in the initial stages and continuously after the person is exposed in the workplace. So this will ensure the reduction of the burden on the poor health status. Health monitoring. So how do we define this term? This may be defined as a technique of observation and tracking of the health status in a community over a period of time. This includes a review of the health status of the employers, the workers at regular intervals by the employer, and this is also referred to as the occupational health surveillance. The objective of this health monitoring, that is to identify and set the trend of the health status, and this trend can either be by the development or deterioration. Monitoring the health also helps in identifying the onset of the new diseases in a community under the surveillance, especially after the introduction of a new stimulus. Let us understand this with the help of a case study. So this new stimulus, this can be a factor or an unaccustomed habit, and when a relationship between the given stimulus and the disease is identified, then this intervention is undertaken, it will be undertaken to reduce or to eliminate the stimulus whenever it is possible. This will actually be followed by evaluation and the test to see the effectiveness of this intervention, like how successful this was. So now let us see this with the help of a case study. In a factory, 100 workers are working in a roller mill, and the noise output of this is around 75 decibels. So the audiogram of all the 100 people, the 100 workers, they were very normal when they were initially tested. Now to improve the productivity, what the management decides is, let us go for a new machine and that will be effective. Now this modern machinery in the mill, that is producing 92 decibels. So this noise output has increased. So in the subsequent health surveillance program, because they are being constantly monitored, it is found that 50% of the workers, that is 56 out of 100, they have the hearing loss. So what do we understand from this study? Here, the recordings of the audiogram for the 100 workers every year, that is termed as the health monitoring, or the health of the workers is being monitored. The excess noise, that is the stimulus. The new disease that had not previously existed in the group of the workers, that is termed as a hearing loss. And we can therefore attribute the increase in the noise levels of this new machinery to the decrease in the hearing capacity of the workers. So as the hearing loss was induced by noise, we call this as the noise induced hearing loss, and in the same case scenario, we need to intervene to reduce the noise exposure. So what are the interventions that we can do? Eliminate the noise at its source itself by using some mufflers or changing the machinery to a soundless one. Removal of the individual from exposure, that is the person, you are removing him from the exposure. Isolation of the noise source, that can also be kept caged, or you can keep it in a special place. And also you can also protect the individual by giving him some kind of ear mufflers and certain other personal protective equipments, so that he can be protected from this heavy noise. So these are the interventions that can be done. So from this we can understand that when you monitor the health worker or monitor the workers in any industry, then you can understand how you can best possibly give the solutions for tackling the problem. Sickness, absenteeism, this also we see in many of the sectors, that people tend to take leave because they just say that some kind of a problem, and they say that they are sick, they are on sick leave. So this absence due to sickness, this is a common problem which is affecting the productivity of the hospital staff, and it also serves to estimate the health status of the healthcare industry. So here again we can keep a record or a register, and we can see how many of the employees in a month they are absent on the reason of the sickness. Here again the health status of the healthcare workers can be maintained. Analysis of the sickness absent data, that will reveal the significant lifestyle problems which are affecting the health employees, and this can be addressed during the intervention problems and the programs. Rehabilitation. So to reduce the incidence of the sickness or absence in an industry, a technique called as rehabilitation can be used. So this is basically relocating a person of work who is convalescing. You can actually from an illness or an injury at a workplace which does not interfere with his recovery. So that means a person who is sick or he is recovering from some kind of a problem, maybe he has even undergone a recent operation. In that case, you can give him some kind of a work, you are relocating him to such kind of a work sector where his recovery is not interfering with the type of work activity that he is performing. Health indicators. There is no existing definition for measuring the health, but it is important that we have some kind of a measure for health, not only to establish the health status in the community, but also to determine the assessment needs of the health needs, or the assessment of health needs in a community. For the purposes of, as I told you, record keeping, and also we need to find some interventions. Training needs have to be sorted out. So these are all important in a given group of people. We have some kind of measures for health, but not only to establish the health status in the community, but also to bring about certain training programs or to bring about certain interventions so that we can tackle this problem effectively. So health indicators, they will help us to provide a rough measure of the health, and the combination of such indicators, that is also called as the health index. So health indications, they should also have certain important properties. That is, it should be credible, then it should be valid, reliable, it should be specific, it should be sensitive, it should be feasible, and also it should be relevant for the programs whatever we are conducting. In our daily habits, as I already told you that we are having certain lifestyle habits and lifestyle choices that we are making every day. So it is possible that we make some kind of changes to our behavior, and this we also refer or term this as the behavioral changes, And so these behaviors, which are our daily habits or the way we live our lives, so modifying our habits and bringing about behavioral changes in our life, that can also bring about a lot of issues, like it could be positive, it could be negative, and it could also address both of these issues. Now we are aware that an increase in the physical activity, I have given you a lot of examples, that taking maybe small walks in the parks, also in the gymnasiums and so on, this can reduce the amount of problems that you are facing. For example, if you are having type 2 diabetes, or if you are having obesity, and it can also reduce the chances of the early onset diabetes, that we also refer to as the pre-diabetic conditions, hypertension, and also it can prevent dyslipidemia. So making physical activities, like you can enjoy a small game, like you can play tennis, or you can play some kind of a sport, you can visit the gym, you can take long walks, and recreational activities can be done. So all these are lifestyle modifications that we are doing in our daily regime, and that will give us a lot of positive results. In the same way, without proper guidance and advice, any physical activity, when we are doing too much of it without the advice of a medical professional or a doctor, then that can again help in the wear and tear of our bones and the joints, and that can result in the osteoarthritis and certain other problems. Now we can see another example from the occupational health perspective. Like for example, now we see that there is a technological advancement. So more and more people are resorting to computers and technology, and though this has actually improved the way we are working in our life in the offices as well as at home, but then there are a lot of health issues also that we are facing due to this technological advancement. Why? Because we are limiting our physical activity. So earlier the teachers used to walk, they used to go around the classrooms in order to take the classes, but now you are seeing that they are also resorting to online lectures. So there are benefits and there are also advantages as well as disadvantages to such type of the teaching activities. In the same way, you have the smart class boards and the classrooms which are in the school or in the colleges and the universities. So here again the teacher can sit, and he is occupying a sedentary position, and maybe 40 minutes or 1 hour, or in a whole a day of 6 hours, if he is resorting to sitting for 3 to 4 hours, then again there are certain problems which are going to occur with his health. So though work has been made easier by such kind of advancements, because definitely through such kind of the online lectures, even in the case of the medical training professionals, when we are addressing training programs for the healthcare workers, they are getting to listen to a lot of experts, not only from the entire country but from the entire world globally. But there are certain problems related due to the reduced physical activity, and this can result in overweight, obesity, eye strain, then the bone and the joint issues such as carpal tunnel syndrome of the wrist, because the whole time when they are working on the keyboards and on the computer things, then again the wrist will get affected in a long term process. Knowledge, attitude, and the perception. So before we advocate certain behavioral changes to mitigate these unwanted health issues, we need to understand the knowledge, the attitude, and the perception of a community. So for any transformation to come, it has to come from within. If I tell a person that you can sing, you can dance, but unless a person is not ready from within, he is not ready to do it and convinced of himself that I can and I can do it, only then that these things can come out. So only that a person is convinced that yes, I can do these lifestyle modifications in my life, I can go to the gym, I can bring about a lot of changes in my life, and I will not eat or resort to eating unhygienic and the junk food, or those which are actually having a lot of the fat content in them. Only then, so this transformation must come from within. Then you will see that there is a lot of thing which can be even managed very easily at home itself by the workers. So intervention. This is basically to identify the lifestyle diseases and disorders, measure their prevalence in a population, identify the most dominant diseases and the latent diseases, understand which are the ones that need to be addressed, and gauge the awareness levels and the behaviors of the community. With this, we can plan on how to intervene at various levels, train the community, and also influence them to adopt the healthy habits, and this purpose is basically to promote good health. The concept of training. So this is an intervention, and it is definitely multi-dimensional or multifaceted. And when we are dealing with this workforce in a hospital setting, we need to make the training as interactive as possible, so that the people are actually benefited from such kind of the programs. It also needs to be very influential so that they get the desired results. So by bringing about a change in this behavior, we can achieve the desired results. So for example, let us now understand this with a case study. In a factory in Italy, okay, the workmen, they refused to wear the goggles, and they were actually working in an area which is involving welding. So this a lot of the light and the sparks which can come and can affect their eyes. And they complained to the management that these goggles were very heavy, and they were not fashionable, and they didn't like to wear these goggles for any kind of a reason. So the management, when they got the problem, when they got to know of this problem, they thought innovatively. They thought, let us do something creative so that the people are able to manage and wear these goggles, and also their eyes are protected in the process. So at that time, the movie Matrix was released. You may be seeing even in Netflix, even now this comes, and which released, and it featured Reeves, and he was wearing a very fashionable goggles and a sunglass which appeared to be cool. So when the factory workers got this new goggles, which was lightweight, and it just appeared as if they were a movie star, and they were they were wearing the same thing that Reeves wore, they actually felt happy, and all of them immediately started wearing these goggles. So this is what I say, that the management redesigned the goggles in such a way, in the shape of these safety goggles were designed in the same way which appeared in the movie. So they looked fashionable, they looked trendy, and the workers then, they were always wearing the goggles when they were working, when doing the welding activities. So this is some kind of a positive intervention that has taken place, that motivated the workers in order to work safely while wearing their safety devices. So this is what they say, that there has to be a friendly relation between the management as well as the employees, so their problems are tackled in a very easily and very nice way. Counseling. This is another mode of the training which is done by direct, that is face-to-face contact with the employees and the healthcare workers or the industrial workers. So this is done verbally. So sometimes there may be situations when you are not able to discuss your problems with your family members at home, but it does work when you are working with a psychologist, with a healthcare worker. So then this is more participative, and then they are giving you more importance, more emphasis. The problems are being tackled in a nice way, and the counselor and the counselee, they are interacting so that they come to achieve the solution for this goal. So this has been considered as a very effective mode of counseling and influencing behavioral patterns. Health education. So now this you would have seen, whether it is in the television or even the posters that you are seeing on the roadsides. So that is basically in order to bring about awareness among the people, like smoking is injurious to health, so do not smoke. Or they give you some kind of a poster which is showing the charring of the lungs. In the same way, alcohol, they are showing that how a person is dizzy and how his health or the family members are being affected due to the loss of his life. So this is the purpose of health education, that it is providing the population some kind of awareness, knowledge of the disease, and it is providing the health information to reinforce the desired behavioral patterns in the human beings and the society at large. So among the healthcare workers, this can be expanded to include the new treatment modalities, latest research findings, and for example, now we had this Corona-19 or the COVID-19 which came up as a pandemic, and this may still keep mutating for a few years, and we will find the new variants that are coming up. So this health education and campaign programs, like for example for getting people motivated to getting them vaccinated, that also required a lot of health education and campaigns. So it was not possible, it was not achievable in a single day. In the same way, to wear the mask and to wear the personal protective equipments, to sanitize your hands, all these are part of the health education program, and all this can be managed effectively in very simple ways. But at the same time, like heavy jargons also should not be used. Whatever language and whatever posters that are being made, that also should be acceptable to the society, and it should come within the law and the framework of the healthcare settings. So the objectives of this health education, they are to encourage the people in order to adopt and follow healthy lifestyles, to arouse interest on the health, to promote participation in the health program, and to increase the utilization of the health service available to them. Health education must follow the principles as we discussed before. It should be the credibility, that the health information should be shared from a reliable and trustworthy source. And it should be interesting and thought provoking, and it should have the capacity of attracting a person's attention. Participation. So whatever the magnitude of the efforts that are taken, the community participation is very important. And the health education program should involve the active participation of members from all sectors of the community. So within the community also you will see that small groups are being made, and then they can again go and talk to the people in the different residential localities and bring about a desired change in the community. Motivational. So here again you can have that, you can reward the people who are doing some good things, like people who have quit the smoking or who have got themselves vaccinated, giving them an incentive or making them as a best employee of the month. Such kind of incentives and motivation can also promote the employees' health and well-being. Then the follow-up. So people do not understand everything in the first session of the counseling. So repeated training programs are required so that these aspects are being reinforced. They are being said again and again, and then people start realizing, okay, I need to get vaccinated now. Okay, so this disease is something really alarming. I need to act upon this. So such kind of reinforcing programs and trainings are also very important so that the public get their attention. So this how the community has to be monitored for their awareness levels. Now lifestyle modifications we already discussed, but then this should be sustainable and it should become a routine in one's lives. It is not that one day you adopt to a healthy lifestyle and the second day again you come back to your old ways. It doesn't work that way. So it includes increasing the knowledge levels, correcting the attitude and implementing all this in our daily practices and lives. So therefore resilience programs need to be conducted by the management professionals. So these resilience literally means bouncing back. So these programs are conducted for the workforce and they are facilitated by the occupational health specialist and also with the help of a psychologist. So for example, they can have staff picnics and get-togethers where the staff members can go for a holiday together. They can go to the hill stations, and these can be conducted at subsidized rates so that the employees can be relieved of the financial, psychological and the psychosocial stress. Now in the same way, meditation and yoga can be a very important thing in order to reduce stress. Then Tai Chi is another type of the slow dance come martial arts technique which can also help to reduce stress. Then mandatory leave, the employees sometimes they are entitled for the paid leave in order to relax and take a break from their routine activities, and this is a very effective option, and the employees are paid special allowances such as leave travel allowance so that they can visit a place of their choice and for the recreation purpose. Then of course we can take the walks and we can go to the parks, the prayer halls, the recreation halls, and all these measures will improve the spiritual and the mental well-being of the individuals. Thereby we can reduce our stress levels. Now for the diet related problems, diet counseling can be done, which is an integral part on intervention on the diet habits, and the workforce has to be educated to have the knowledge about the food that they eat. So here again the diet counseling, the counselors can prepare a food chart, and the person specific diet charts can also be issued taking into consideration the pre-existing health conditions. Canteen hygiene is also very important because a canteen is serving the food for most of the healthcare workers and their sources. So the management should inspect the canteen, the cooking area, and the Food Safety and Standards Authority of India 2006. They have made it compulsory for all the food handlers in a canteen to be vaccinated for even the enteric diseases like typhoid, hepatitis A and so on. Also for the tobacco, the alcohol and the drug substance use, here again this can also, the management can also support and sponsor the rehabilitation processes so that the employees can quit the alcohol and other problems, because this is also directly or indirectly related to nearly 3 million deaths every year throughout the world. Finally, the sectors also need to focus on the protective equipments compliance like the goggles, masks and the gowns, and also in the hospitals they have lot of the X-ray and the radiology department. So there again the engineering controls and the administrative controls are very much required to be in place for the safety of the workers. Finally, the recognize and the reward. Good health should be recognized and rewarded, and the rewarded employees must be displayed on their, on the notice boards, and these people should be motivated as their peers. They should be made as role models, and they can be made to speak in front of a gathering and to motivate the others so that they also quit their unhealthy choices. And their photographs can be displayed, and they can also be used as health advocates. So my dear viewers and the learners, I hope you have had a good understanding of this session on health education counseling, and how this can be made a very important and an effective way to implement the problems that we are facing in various industries, especially in the healthcare sector. Thank you for your patient listening.